Hi, very good morning. Sorry for the delay. So today we're going to have this image-based discussion on the topic from the prosthodontics. I will be covering a few images from a removable partial denture as well as from fixed partial denture topics, and we'll see how as many, and we'll try to cover as many as possible. Right? I hope I'm audible. If I'm not audible, just let me know. I'll raise my voice. I think we have around 25 to 30 images. We'll try to cover all of them as soon as possible. It's already 6:20, right? Hi everyone, a very good morning. So first we'll start with few illustrations in order to discuss few important topics or concepts pertaining to occlusion. So as you can see here, we'll start with the first one. Just give me 1 second. I hope I'm audible, right? Yeah. So if you look at this illustration, this illustration represents protrusive movement, as you can see, and also the direction of movement of condyle with respect to articular eminence or the glenoid fossa is very important. As you can observe, the condyle moves downwards and forwards during protrusive movement of mandible. This is very important, and this can be represented in the following image. So during protrusive movements, as it is represented by this arrow, there is a downward and forward movement of condyle, right? So that's very important. And also we'll discuss few other illustrations which represent a few different motions altogether. So as we have discussed previously in one of the live sessions, so this is pertaining to working side and non-working side. So as you can see, when you're moving your mandible towards one side, so in this case it's left, so the side towards which the mandible is moved is working side, and the opposite side is considered as a non-working side. The point here to be noted is the movement or the direction of movement of condyles, as you can see. So on the working side, you can see the condyles are moving backwards or posteriorly and laterally. So the movement of condyle in working side, it is latero-posterior. Whereas you can see here the movement of condyle on the non-working side, it's forwards and medial. So this direction has to be noted, and it's very important, as they can ask you a question related to the same. They can ask you what is the direction of movement of condyle in a working side or on the non-working side, right? So that's very important. Yeah. I hope I'm audible, right? Do let me know if you have any issues with hearing, because this is a big hall, so maybe you will have some issues. I need to raise my voice, right? So let me know if I'm not audible. And also give me 2 minutes. I'll just increase the screen out time. It's just going off very frequently. Yeah, thanks. So the direction of movement of condyles is very important. So I think it's clear, right? The side towards which the mandible moves is considered to be working side, and the opposite side is considered as a non-working side. And also this direction of movement of condyle is very, very important. So on the working side, you can see it's represented by the arrows. The direction of movement of condyle is latero-posterior. It moves laterally and it moves posteriorly. Whereas in case of non-working side condyle, you can clearly see that the condyle is moving forwards and medially. So medial or lateral, we're talking in terms of the sagittal plane, with respect to sagittal plane, right? I hope it's clear. Yeah. Okay. Now let's move on to the next kind of movement. So after seeing this working side and non-working side, we also discussed about working side interferences and non-working side interferences. So to clarify that concept once again, yeah, as you can see here in this illustration, I hope it's clear, right? So the mandible is moving towards the left side. So this is your working side, right? So as you can see, there are certain interferences. I mean, whenever you have tooth contact in the posterior region, you consider that as interference, whereas anterior teeth, you consider that as guidance, as we discussed previously in one of the textbook discussions. So you can see here, working side, there are certain interferences. So working side interferences are seen because of the contacts between the lingual cusp of lower teeth, that is mandibular molar, or the palatal cusp of the upper molar. So this is very important. And to be more specific, the facial incline of the lingual cusp of lower molar, or the palatal incline or lingual incline of palatal cusp of upper molar as represented by this image. So this is very important. I think you have already noted all these points in yesterday's MCQ discussion also. We had few MCQs pertaining to the same. So working side interferences are because of facial inclines of lingual cusp of mandibular molar, or lingual inclines of palatal cusp of maxillary molars, right? I hope it's clear. Now we have something called as non-working side interferences. So here the mandible is being moved to the right, so the left becomes non-working side or balancing side. So in case of non-working or balancing side, the interferences which we see here are because of the following cusps. So I think you can make out from this image, and if you can make out, just drop in the form of comment what interferences we have here, and these interferences on non-working side are because of which cuspal inclines. Yeah, Bull's law is for your selective grinding. Yes. Yes, Saida, I hope it's clear. I have already repeated the first image. So non-working side interferences are because of the following cuspal inclines. I mean, if you can see that clearly, you can just type it in the comments, because already we discussed the same in yesterday's MCQ discussion also, right? Yes, Preeti, palatal cusp of upper and buccal cusp of lower. And to be more specific, you can see the buccal cusp of lower molar, the lingual incline, whereas upper palatal cusp, the facial incline, isn't it? Yeah. So non-working side interferences are because of the buccal cusp of lower or palatal cusp of upper molar, right? So that's very important. So working side and non-working side interferences, make a note of these points. Next. So what about protrusive interferences? So far we have seen about these working side and non-working side interferences, and also the movement of condyle. And what about protrusive interferences? So during protrusion, as you can see here, there can be interference between the distal slope of facial cusp of upper teeth with the mesial slope of facial cusp of lower teeth. So protrusive interferences can be because of the distal inclines of upper facial cusp and mesial inclines of lower facial cusp. Now, also we discussed another important concept pertaining to guidance systems. We have this anterior guidance system and posterior guidance system. So posterior guidance system is something which is provided by the temporomandibular joint. Anterior guidance system is something which is provided by all the teeth. It's not just anterior teeth but even posterior teeth. But this schematic representation beautifully tells the relation between the influence of TMJ on anterior guidance. As you can see here, so as we move on from posterior to anterior, the anterior guidance is more seen with respect to anterior teeth. Also, we discussed the same point previously. The farther the teeth from the TMJ, the better the guidance they will have on the movement of mandible. So guidance is nothing but your mandible is being guided not only by your muscles but also by your TMJ and by your teeth. So that's the guidance we're talking about here. Guidance to movement of mandible. So as we move on anteriorly, the anterior teeth guide well compared to posterior teeth because of their location. Also, we discussed about these concepts of levers and fulcrums. We're going to discuss that schematically today as well. So the farther the teeth from the TMJ, the lesser the influence they have on TMJ and they guide better. So that's the reason why whenever you have the contacts between posterior teeth, you consider that as an interference rather than a guidance. Whereas the contacts between anterior teeth, as you can see in case of protrusive movement, just protrude your jaw. We have already done that yesterday, and you can see that anterior teeth occlude and the posterior teeth disocclude, right? So anterior teeth, they are near ideal to anterior guidance compared to your posterior teeth, and this can be represented by this schematic illustration, right? Now, I'll just project you some images of edentulous scars, partial edentulous scars. Let me know what Kennedy's classification that particular cast belongs to, right? Already we had one video in e-classes also, and Kennedy's classification along with various modifications, right? So we just have 6 or 7 images pertaining to that. You can just identify accordingly. So we'll start with the first one. Yeah. Yes, Soumya, Ramesh, good. Yeah. I haven't seen your comment, by the way. Right. So identify this partial edentulous cast and let me know which Kennedy's classification it belongs to. I hope you can see, right? You have teeth all over except for this area. So in third quadrant, you have edentulous area covered by teeth, natural teeth anteriorly as well as posteriorly. So what Kennedy's classification does this fall into? Class 3. So class 3 is nothing but edentulous space posteriorly, which is bound by natural teeth anteroposteriorly, right? So it's an edentulous space, as you can see, which is bound by natural teeth anteriorly as posteriorly. So this is Kennedy's class 3. And what about this? So what does this cast represent? You have unilateral posterior edentulous area. So this falls under. Good. So obviously it is, yeah, class 2, isn't it? Kennedy's class 2. And we have posterior bilateral edentulous areas, and this falls under the classification. Yes, Ramesh, Priti, Purvel, Prithvi, Megha, Abhishek, Neetu, Saida, Komal, Pooja, right? So 1, right? Okay. Yes, Praveen, Regina. Now, I'll show you a few other images. So what about this cast? So what does this cast or what classification does it fall under? You can see various edentulous areas, right? So how do you classify and on what basis do you give this particular orientation or assign this to a particular classification? So obviously whenever you see such cases, the posterior most edentulous area decides the classification first, right? So the posterior most edentulous area is present towards the second quadrant, as you can see, which is bound by teeth anteroposteriorly. And also you have few additional edentulous spaces, 2 in number, not based on the number of teeth missing, but based on the number of spaces present. That's it. As simple as that. Right? So it is wonderful. Good. So it belongs to class 3, right? Class 3, modification 2. Good. And what about this? So lower caste, where you can see almost 1, 2, 3 edentulous spaces. I mean, if third molar is missing and it need not be restored or reconstructed, then there is no point in including that in classification, right? So you can neglect this edentulous area. So you have unilateral posterior edentulous area along with an additional 2 additional spaces. So it's a, right, you say class 2 modification 2. Cool. Wonderful. Now, so it's a class 2 modification 2, right? And what about this? So you can see it's an upper caste, unilateral posterior edentulous area and with an additional edentulous space on the first quadrant. So obviously this is going to decide a classification because this is the posterior most edentulous space compared to the first quadrant. Yeah, good. So it's class 2 modification 1, right? Good. And I think this is the not final, right? We still have, I mean, what about this? So lower caste, you can see again unilateral posterior edentulous area followed by an additional edentulous space. So obviously even this comes under class 2 modification 1, right? Yeah. And what about this? You have an edentulous space anteriorly which is crossing the midline. Class 4, okay. Yeah, good. So it belongs to class 4. And what about this? So you have a lower caste with edentulous area on third quadrant, which is bound by natural teeth anteroposteriorly or mesiodistal. So this belongs to, obviously it's a class 3, right? Yeah. And unilateral posterior edentulous area represents, so it's unilateral posterior edentulous area. Yeah. So it's class 2. And finally we have posterior bilateral edentulous area, which represents good. It represents class 1. Canada is class 1. And I wonder, most of you are online, maybe because it's after 6, right? If I say 5, very few of you will turn up. Right. So this completes our Canada's classification. Now let's discuss few additional concepts pertaining to these machines and also pertaining to this fulcrum and lever. We have this confusion, right? So which belongs to which class of lever and all. So we'll just have a brief description pertaining to these things now. So can you identify these things? So this illustration represents various machines. So we have these simple machines and complex machines. And can you define a machine? Have you heard of this question anytime? If someone asks you, like, these are all machines, in fact. These are simple machines. So if someone asks you, like, can you define a machine? Have you heard that question anytime? Okay, come on. Define machine now. Don't expect me to give a demo for a machine. So a machine is something which simplifies the work which we do, isn't it? So we have various machines like simple machines and complex machines. So a complex machine is obviously a combination of various simple machines, and all these 6 which you can see here, they're all examples or illustrations for simple machines. Exactly, machine is anything that reduces human effort. Right, so you can see the first concept here, concept of lever and fulcrum. So lever and fulcrum, it's nothing but assume that you have this bar of metal and which rotates around a particular pivot or joint. So we have these principles of lever and fulcrum which we'll discuss later, and we have this wedge which is a form of another simple machine, and an inclined plane, screwing, pulley, wheel and axle. So this is just for completion of topic. I have put all these illustrations, but we'll be focusing mainly on fulcrum and lever. And you know what? Lever and inclined planes, these designs of machines have to be avoided while constructing removable partial denture, and please make a note of that. It's directly given in your McCracken. So of all these machines, lever and inclined plane should be avoided, as there can be abnormal forces acting, as there can be damage to soft tissues, or there can be lack of retention or stability to your removable partial denture. So we have to minimize this and make sure that we don't incorporate them as much as possible. So the machine designs which are not favorable for a removable partial denture include lever and inclined plane, right? So that's the point which I wanted to make out. And also we'll be using one or more of them in our day-to-day practice. For example, if you take screw, where do you use this concept of screw system in our dentistry? Can you just give me one illustration? Yeah, Vishek, by the way, it belongs to first order or class 1. We'll discuss that again. So an example, where you incorporate this screw system while you're practicing dentistry. Good. It can be plating, very good. Implant, reduction of fractures, and also placement of pins. You have this complex amalgam pin placement. Good, isn't it? So screwing. And what about wedging? Where do you use this machine concept, simple machine concept of wedging? Yes, Neetu, Ramesh, pretty good. Yeah, full denture on implants, reduction of fractures, right. And what about, yeah, amalgam pins, right. Amalgam pin is nothing but extension of amalgam into your pin, right? Okay, fine. So where do you use this concept of wedge? Elevators, fantastic. Yeah, contacts, good. To establish your contacts, we have this wedging again. Yeah, good, right. So what about inclined planes? Inclined planes, if you know any examples for this, any of these, you can just mention them. Not sure we'll be using this wheel and pulley or wheel and axle. Lever. Exponential is all about this, right? So you know what, for example, you're applying a force here. This is called as effort, right? And you have some load here, you're trying to lift the load, so this forms the load. So you have something called as effort arm and load arm in the concept of levers and principles. So exponential is all about that, right? The longer the effort arm, the more convenient for you to apply the load in a simplified manner. That's what I said even previously. Assume that you have a huge rock in front of you. So how do you lift that? We wedge material between that, and we'll try to lift with the help of a stone. For example, assume that you have a huge rock in front of you, and this is a stick which you're carrying. So you'll try to wedge it and you will try to hold this stick as farther as possible and try to apply the effort, right? So the longer the effort arm, the more mechanical advantage you're going to have, and this is very important. Assume that you're holding the stick very close to the huge rock. You can't just apply the force adequately to lift the rock, isn't it? So that's quite logical. So you hold it as long as possible, increase the length of your effort arm, and then try to move even a huge rock, isn't it? So that's the principle of levers and fulcrum, which we'll discuss that again subsequently. So exodontia, you can quote that as an example, isn't it? Yeah. Yes. So we'll just proceed with the next topic, that is your principles of lever and fulcrum. So we have three principles, as you all know. So we'll go with the first. So we have three classes of a lever and principle. As you can see here, this represents the first class. So what can you make out here? So you have, as we have seen in the previous illustration also, so we have a fulcrum. Fulcrum is nothing but a point around which there is a movement, right? So we can see a long bar, we can see a fulcrum, you can see effort on one side and resistance on other side. Effort is nothing but the force which is being the force which is acting, and resistance is resistance to the force, and this is nothing but your load, right? For example, the best example for this, so in first class, as you can see, first class of levers and fulcrums, fulcrum is in center. Make a note of these points, this is very important and you should never get confused, and we'll also apply the same to our oral cavity as such, right? So you can see fulcrum is in the center, effort on one side, resistance on the other side. So this kind of orientation falls under first class of lever and fulcrum. And the best illustration for this is, which we're all familiar with, seesaw, which we played during our childhood, isn't it? Yeah, the fulcrum is in center, as you can see, and this guy is trying to apply force, downward force, and this guy tries to resist it, something like that. So effort arm, load arm, or resistance arm. Now the same can be applied in case of your distal extension denture basis, or in case of your RPD, especially when you have a mesial rest. So let me just translate what we have seen so far to that which we are seeing here in RPD. So the effort which we are talking about, so we'll start from here. You can see the effort, right? Effort is nothing but force, right? Isn't it? It's clear, right? So this force can be either because of the occlusal forces during mastication or parafunction habits or whatever, or the force can also include your gravity. It's mandible, so not much influence of gravity. What about if it's a maxilla? So even the gravitational force, so any force falls under the category of effort, right? And here you can see fulcrum. So fulcrum is a point around which movement occurs. So fulcrum here is represented by, you can see here, right? So what is this? So fulcrum is represented by, and what about resistance? So resistance is being, you can see this retainer which resists the movement and helps in stabilizing the denture, right? So this resistance is represented by the following component, and fulcrum is represented by the following component, right? So name those components. It should be obvious for you now. Okay, right, you still play. Good. So in cases of distal extension partial dentures, when you have a distal rest, so you have fulcrum in the center with effort and resistance on the opposite side, so this falls under class 1. And exactly, Ramesh, good. So I'm just expecting that answer. So the occlusal rest acts as a fulcrum. So fulcrum is represented by, so you can draw an analogy, right? So fulcrum, occlusal rest, and your retainers, whatever you use, these retainers, primary retainers, clasps, your I-bar retainers, primary retention, so they are something which are resisting the force, right? So that represents your R. So the same thing which we have seen here. So the same concept which we have seen here, right? So fulcrum in the middle, effort and resistance on the opposite sides. I'm intentionally taking some time here because often we get confused with these principles of lever and fulcrum and how to apply that. So once you have the the clarity in concept, like how each class is, then it will be much clear for you to compare that in an actual case scenario, right? So we can see in this context, fulcrum represented by rest with effort and resistance on either side. So distal extension partial dentures, for example, with a distal rest, occlusal rest, right? So now let's move on to the next one. Good. So this illustration is for your second class, class 2 of fulcrum and lever. So as you can see here, resistance is in the center with fulcrum and effort on the opposite directions, right? Just give me 1 second. Right. So class 2 lever, you can see resistance in the center with fulcrum and lever, that is effort on the opposite sides. And you can just, the best way to remember all these things is by imagining the pictorial representations given here. So class 1, even if you don't remember, just remember that when you're in first class or something, you're playing this seesaw. Just remember this image, it will be easy for you to remember the concept, right? So class 2, just remember this concept. So in class 2, as we discussed, resistance is in the center, that's it. So you can see here, a man carrying a wheelbarrow. You can see fulcrum which is present. We might have seen these things in railway stations or anywhere, right? So you have this wheel which acts as the fulcrum around which the movement can happen, and you have this load. So resistance is nothing but assume that it's load, as we discussed previously, load. And then you have effort. Effort is the force which you're carrying, right? So effort, fulcrum with resistance in the center. Just imagine this picture, just remember this picture. Class 2 is done. So the same thing when compared to a distal extension partial denture. So what does this represent? Have you seen this previously? We discussed in our live session also, in one of the virtual classroom sessions. Yeah. You can see a retainer which is approaching from the gingival aspect, and you have a mesial rest. So what is this concept of RPA? Exactly, I-bar, RPA, right? So I-bar removable partial denture, where you can see gingivally approaching a direct retainer, a mesial rest, and your distal extension denture base. Proximal plate, they're all not visible, but you can remember that in a simplified manner by getting that picture into your mind. So you can see here, the gravitational force can act as your effort arm or force. So E represents your effort, which can be gravitational force, occlusal force, or any sticky substance, masticatory forces, etc. And you can see that as we discussed. So fulcrum, your rests act as fulcrum. So you have fulcrum shifted towards the mesial side, right? So the fulcrum is being pushed away from the edentulous area. So that's what we discussed previously also. So the design is in such a way that the rest is placed far from the edentulous space, so that the fulcrum is shifted away from the edentulous spaces, so that there will be minimum forces acting on the soft tissues, right? So minimal damage comparatively. So resistance by your retainer. So resistance is in the center of your effort arm and fulcrum arm, as we have seen in the previous illustration also, right? So resistance in the center, again resistance in the center, right? The same concept. So this design represents your class 2, in fact. And finally you have this class 3. So class 3, effort is in the center, effort or force is in the center with resistance and fulcrum on the opposite sides. And you can remember that by this simple illustration. fishing. You can see a person trying to pull out a fish. Obviously it resists, right? So the load is being applied here. And fulcrum is almost near your hands, right? Fulcrum. And your effort is somewhere here, isn't it? So this represents your class 3 lever and fulcrum. And you can see here a beautiful illustration with a removable partial denture with a natural teeth on either side. So you have retainer which acts as a load arm or resistance, and you have fulcrum on one side, and there can be occlusal forces or sticky foots, right? So these are your 3 classes. So you can apply the same anywhere. And let me just ask you one question and I'll leave it unanswered. Just find out and let me know. So you have this mandible, right? Oral cavity mandible, you have this temporomandibular joint. So you have various muscles and you have this occlusion and all. So what principle does this represent, or which class of lever and fulcrum does mandible belong to? Because you have fulcrum here, fulcrum in the sense where point where the movement happens, and you have your effort which is being put by your muscles. So your muscles help in mastication, muscles of mastication, so effort, and also we have this load acting on your teeth, right? So which class of lever and fulcrum does it fall under? Do let me know. Now let's go through a few of the illustrations, and that's mainly pertaining to these major connectors, and we'll see how many you can identify them, right? Yeah, we'll start with the first one. We'll start with the maxilla, right? Class 3, wonderful. So you have this fulcrum here, TMJ, your muscles in between, and then you have load which is acting here, right? So effort is almost present in the center, wonderful. So there was in fact one question on this also, right? So assume that you have fulcrum here, the temporomandibular joint, the muscles between your teeth and your fulcrum, and then you have your teeth anteriorly, that is your load. Clear? Now let's go through identification of few major connectors and let me know a few important points pertaining to them also. So what does this image represent? So you can see 2 bars, anterior and posterior. So what does it represent? Which type of major connector? So we have different types of major connector and minor connector. A major connector, again in major connectors you have this maxillary and mandibular major connectors, and major connector is something which joins all the components of your removable partial denture, right? Closed horseshoe, okay, right. You can see palatal bar, anterior and posterior. So antero-posterior palatal bar, which is joined by 2 longitudinal elements, so that you'll have this circular effect. So anterior bar and posterior bar. In fact, anteriorly this is your palatal strap, which is modified, which is reduced in thickness, and this is a posterior bar, right? So antero-posterior bar or double palatal bar. So what does this represent? So this is also a maxillary major connector. You can see a single extension which is crossing the palate, right? So what does this image represent? So single palatal bar, the cross section is half, oval shape, half oval shape. So the cross section will be half oval shape, and we have various drawbacks, like for example, it doesn't have this stiffness comparatively, right? So single palatal bar, which is extending across the palate, and with a cross section which is similar to that of half oval, right? So this is a single palatal bar. And what does this image represent? So obviously it's a palatal strap. So you can see the increased thickness, and the minimum thickness has to be 8 mm in order to have that adequate rigidity, right? So this is your palatal strap. Yeah, Komal, it's a 7, I think, right? We still have just few more images. Anyways, just carry on. You can just watch the recorded video later. Yeah, bye. And you have this. So what does this image represent? There is complete coverage of palate. Yes, Preeti, Abhishek, Urvil. Yes, Neetu, Prithvi. So this is a maxillary major connector which represents complete palate, right? Complete palate or palatal plate. And what does this image represent? A complete palate which has been cut out in the center to accommodate any tori or something. Yeah. So what does this major connector represent? Good. So you need not get confused between bar and palatal strap, right? So this is wider in dimension. So this is antero-posterior palatal strap. Good. Antero-posterior palatal strap. And what does this image represent? Yes, Abhishek. So this is your normal palatal strap. I think we've seen that previously. Okay. So this is your palatal strap, right? Anyways, don't worry. At the end, I will just try to summarize all this once again for another 5-10 minutes. Okay. Right. So what does this major connector represent? I mean, which major connector is this? Obviously, it's a mandible. So far we have completed maxillary major connectors, right? So now let's see a few mandibular major connectors. Actually, this represents labial bar. You can see labial bar, right? Yeah. And what does this image represent? You can see metal extensions onto the palatal aspect covering the cingulum. It's not like a straight bar, but it's going into the embraged spaces. If at all there is any diastema, we have this step back design where the extension would be something like this. A step back design in case of a diastema to prevent metal exposure clinically when the patient smiles or talks. This is not lingual bar, no. No, this is not lingual bar. Yes, Prithvi? Yeah. So it's a cingulum bar, right? So present extending on to your cingulum. It's not double lingual also. Double lingual, where do you see double lingual here? You have only one bar, right? So it's a cingulum bar. And cingulum bar, they are given some dimensions also. 2 mm in height, 2 to 3 mm in height and 1 mm in thickness. Anyways, details next time. Yeah. Now Abhishek. What's this? It's also called as continuous bar. So what does this mandibular major connector, and what is this mandibular major connector? So, I mean, lingual bar is something only when you have a single extension, right? But you have two extensions, a continuous bar. It's also called as, yeah. Good. So it's a double lingual bar. Double lingual bar, the cross section of the lingual bar will be half pear shaped. And as we discussed previously, the cingulum bar, we have this lingual bar combined with cingulum bar. So cingulum bar dimensions, the height would be 2 to 3 mm, approx, and the thickness is 1 mm. Yes, it's a double lingual bar. Good. And what does this image represent? Okay, let me just tell you whether is it a lingual bar or sublingual bar. So it's obviously a mandibular major connector. So what does this represent? Yeah. Good. Lingual plate? No. It's a sublingual bar. I mean, when you compare, you can see it's present more inferiorly and posteriorly, right? Compared to lingual bar. We'll discuss that later. So this is your sublingual bar. So whenever you have this lingual undercut something, so you can go for this sublingual bar, right? So this represents sublingual bar. And what does this represent? Good. So this is obviously a lingual plate. You can see a plate-like extension, lingual plate. Cingulum bar is something which extends only onto the singular, right? Yeah. So the final one, for today's discussion. So what does this image represent? You can see the minimum distance. First of all, the cross section of this major connector is half pear shaped, and also the minimum vertical clearance in order to indicate this major connector is 8 mm from the floor. So from the floor of the mouth, the minimum vertical clearance from the floor of the mouth has to be 8 mm, so that the superior border ends 3 mm short of the gingival margins for adequate clearance and hygiene, and the thickness or height of this lingual bar is at least 5 mm. So 5 plus 3, 8 mm. So 8 mm should be the minimum vertical clearance from the floor of the mouth. So what does this major connector, and yeah, good. Pooja, we covered cingulum bar previously, right? So this is lingual bar. Good. Yeah, it's a bar, lingual bar, right? So this completes our images for today. It's 7:10. So I'll take another 5 minutes to summarize all that we have discussed so far, right? So we'll first start with the illustrations which we discussed initially. Yeah. Yes, already we discussed the height and all in one of the live sessions, because there was one multiple choice question from that topic also. So this illustration represents your protrusive movement. So in protrusive movement, the condyle moves, as you can see, forwards and downwards, right? That's what we wanted to discuss here. And also you have various other illustrations representing different kinds of movements and interferences. So in protrusive movement, there can be interferences between the mesial slope of lower cusp and distal slope of upper cusp, right? Buccal cusp we're talking about. So this is protrusion, and there can be protrusive interferences as well. And the interferences are because of the following cuspal inclines: the mesial of lower, distal of upper. And you can see here working side and non-working side interferences. So working side interferences are because of the facial incline of lingual cusp of lower molar and lingual incline of palatal cusp of upper molar. So working side interferences. And non-working side interferences, the lingual incline of facial cusp of lower molar and facial incline of palatal cusp of upper molar. And working side is that towards which the mandible moves, and non-working side or balancing side is just the opposite. And in working side, you can see the condyle moving latero-posterior, laterally as well as posteriorly, and in non-working side, the movement of condyle is antero-medial. So it's moving forward, downward and medially. And also we discussed this concept where the posterior guidance to your mandible is provided by your TMJ and anterior guidance by your all dentition. And anterior guidance is efficiently provided by your anterior teeth, and whenever there is contact between opposing teeth during the movement of mandible in posterior region, that's considered as interference rather than guidance, which we discussed extensively in yesterday's live session, right? Now, also we discussed about these principles of lever and fulcrum. So these are various simple machines, and these are various classes of levers and fulcrum. So first class where you have fulcrum in the center, and second class where you have resistance in the center, as you can see, and third class you have effort in the center, right? So that's very important. And finally we discussed few major connectors, and before that we also had this identification session. So this is obviously, I'll not just run up through all this, anyways it's clear for you, right? So the posterior most edentulous space is going to decide the classification. So class 1 is your posterior bilateral edentulous area. Class 2 is your unilateral posterior edentulous area. Class 3 is a case where you have edentulous space which is bound by natural teeth anteriorly and posteriorly, and class 4 where you have an edentulous space which is crossing the midline, and any extra number of modifications you have or any number of extra edentulous spaces you have, they fall under modifications, right? So the number of edentulous spaces is translated into number of modifications, but not the number of teeth missing. We're talking only about the number of spaces. I think it's all clear for you, right? So anyways, if you want me to run through these images, I can do it real fast, right? So this is your class 3, right? And this is your class 2, and bilateral, this is class 1, and this is your class 3 with 2 modifications, and class 2 with 2 modifications. This is also your class 2 with 1 modification. So this is your class 2 with again 1 modification. Class 4, class 3, class 2 again, class 1, right? And then we finally discussed few major connectors, right? So this is your antero-posterior palatal bar. Right, fine. So this is your antero-posterior palatal bar, single palatal bar, and this is your palatal strap, palatal plate, antero-posterior palatal strap. By the way, remember this antero-posterior palatal strap has to end in rugae. It should not end on rugae area, it should end into your depressions present on palate. And this is your labial bar. Cingulum bar present on cingulum. Continuous bar or double lingual bar where you have a lingual bar with cingulum bar. Sublingual bar. So when compared to lingual bar, sublingual bar is present more inferiorly and posteriorly. And you have your lingual plate, and this is your lingual bar, right? I hope it's clear. So these are some of the image based discussions which I want to have in this session, right? So if you have any further questions, do let me know, or you can just drop a mail at proudtobedentist@gmail.com, right? So I wish you all the very best, and I see in this PDF the internal communication minutes which is being shared widely. So tentative dates, so January 15th. Anyways, we'll wait for official confirmation, right? Yeah, Prithvi, I'll let you know if at all there is any lecture today, right? Yeah. So anyways, just keep a tab on the official website also. If I come across, I'll let you know as soon as possible. And so you have still time. It's a good news, and take it as much as possible, right? And also this image based discussion, I'll share these images in our Google group, and you can then download them accordingly, and you can revise them at a later date whenever you wish to, right? I hope it's clear. And yeah, 15th January as per the, yes, 15th January. It's been mentioned, but we're still waiting for official confirmation. It's 10th January? Okay. 10th January 2018, right? Okay, right. So keep the momentum going. So if at all I'm planning any lecture today evening, I'll let you know. Mostly I'll not. Anyways, we'll have a general discussion tomorrow, right? Saturday. So that's it. So if at all there is any update, I'll let you know through WhatsApp or even our Google. Okay. Okay, right. Okay. Yeah, glad to hear that. So just keep one thing, keep the momentum going, right? Keep the momentum going. Thumbs up always. There shouldn't be any scope for thumbs down. That's it. And most importantly, try to have or practice. The only thing you have to focus now is practicing as many MCQs as possible, right? So also make sure that you have this good study group where you can share your ideas and share information which adds up to your confidence even further, right? So wish you all the best once again. Love you all, and see you again tomorrow evening 7 or 9 p.m. I'll let you know. If at all I'm planning any live session today evening, I'll surely let you know through WhatsApp and mail. All the very best and have a nice day. Bye. Yes, Regina, glad to hear that. Yeah, you're all welcome. Bye.